Good morning. I try to explain my topic. My topic is AIDS. I don't know if the topic is interesting for you, but is in our century this is a disease very problematic for all and worldwide, because many people die, many people is sick, and in many quantity is of children, more than 1 million is sick for this disease. The scientists think that this disease started in 1920, many years ago. And how this happens? Well, they think that because have a group of hunters they will go to the Democratic Republic of Congo to hunt. The hunters go to looking for chimpanzees, and when they were exposed to the blood of the chimpanzees, they came infected for this virus, because the chimpanzees have the virus, but no, the virus is HIV. No, the AIDS is different, both terms. Well, after the scientists don't know how this disease spread in all the world. They don't know how that happens. This happens in the past. How we can know the difference between HIV and AIDS? Well, the HIV is a virus. If you look these pictures, this disease attack your immune system. It's like the target. This virus is put together these cells on your blood in the virus. For that, your immune system can fight the disease. When you have maybe flu, or you have maybe pneumonia, or if you have cough, your immune system can't fight because don't have defense. Okay, this happens in your body. If the people don't die because have AIDS, die because your immune system can't fight with this, because your defense is very low. You don't have defense with this virus. Well, in the early stage of HIV, you have symptoms, and maybe you can pass for 10 years and you don't know if you have the virus. 10 years, and you can be people who have the virus, and maybe you can give blood for other people, and you transmit this virus to other people. Excuse me. In the early stage of this virus is fever, your swollen glands. Your glands and the glands swollen. You have a sore throat. Fatigue, muscles and joint ache. You feel pain in your body, maybe, and you have a headache. But if you know the symptoms is very, it's like a flu. Maybe you can confused with a flu, or I have a infection in my body, maybe, but that symptoms disappears in a few days, and you will say, okay, but you have HIV, okay? Well, in the statistics in worldwide, according to the World Health Organization, do you know that? World Health Organization, in Spanish, OMS. There were approximately 36.9 million people in all the world living with HIV or AIDS. In 2.6 million, they were children's 15 years. Many child or children, too much children with this disease, many, because the form to spread this disease is when the mother stay in the pregnancy, or when the breastfeeding. Other form to transmit this disease. Other statistics is the shows that the 36.9 million people living with HIV in the all globally, but 17.91 don't know they have in their body HIV. For that, they can spread the virus again. It's a pandemic. That these people can be maybe don't have services about to attention in health. They can test their blood, for to know if they have HIV. Well, this is some image about, we know 2.6 million children worldwide are living with HIV. 36 million people are currently living with HIV in all the world. And the vast majority of people living with HIV in this area, the vast majority is on Africa. It's in Africa. And for going to finish with my exposition, how is HIV spread? Do you know that? Do you have any ideas? How is HIV spread? How transmit? I don't know. Do you know?
Yes.
Any ideas?
Yes.
Like what's how? Excuse me. How is it spread this? Do you know?
For contact. For contact.
No.
By the blood.
Blood. Yes. Other?
Sexual.
Huh?
Sexual.
Yes. For the sex. For needles. Yes.
Newborns. Mothers to newborns.
Yes, exactly. The breastfeeding. Yes. Well, and the first how is HIV spread is for blood, is semen, breast seminal fluids too, rectal fluids, vaginal fluids, and breast milk. You know, it's just not for all fluids. Saliva, no. If you give a hug, no. If you share the toilet, no. If you share a glass, no, not either. Just some fluids. It's very interesting for me how this disease come and put a stop to our bad forms to handle them or sexually, because it's more about or sexually is the first or the principal form to spread this disease. HIV is not spread about the air or water or insects. Oh my gosh, one zancudo, I don't remember how to say, stay here and you have AIDS and maybe I have it. No, it's impossible. Tears or sweat, either casual contact, hey, handshake, no matter, don't have anything. Or if I have somebody, or drinking fountains or toilet seats, nothing. For ending, if I have, it's a question, if I have HIV, does that mean if I have AIDS? No. If you have HIV, you have the virus. But if you use therapy of retrovirals, you can keep your life okay, because you are using retrovirals. But if I don't know if I have HIV at past 10 years, maybe 15 years, I feel different symptoms, very, very horrible, like manchas, I can't remember that. I have this. Excuse me, I have this. Yes. For example, rapid weight loss. You lose weight very, very quickly. Diarrhea for many weeks. Pneumonia is one of the several problems. Sores of the mouth. Sores is the word. Llagas, sores. In the anus and the area genital too. You prolong swelling. You swelling. You can stay your bed with very, very wet for your sweat. Extreme and explaining tiredness. I feel very tired, very, very tired, very, very tired. Recurrent fever. I will say okay. I took some pills and I have fever, but I'm okay. After you have fever again, red, brown, pink or purplish blotches. You have here purple blotches. Do you remember movie Philadelphia? Do you remember? Sometimes did you see that movie? Tom Hanks have a horrible purplish blotches. Purplish, like the color of the shirt of Fernando. Purplish, yes? Blotches you have is horrible. But isn't the progression of AIDS? I was telling you that the HIV is just the virus. But if you have AIDS, you are in the last stage of this disease. It's the last stage. AIDS is the last stage. Maybe I have HIV. We can live many years. For example, Magic Johnson. He has HIV. Maybe he have a therapy of retrovirals. Now he's living. He's living, right? And he have many years to have this virus. Okay. Well, I don't know. This is the most important about this, and we can have maybe the reflex in this, and we can have a good think when I have to have sex. What kind of people we can do? Yes, okay, come to my bed. And that's a real problem if you don't have protection. But if you use a condom, for example, it's not the 100% to security. you don't get that kind of disease, that maybe you can destroy your life, because it's probably cultural, social, maybe on work, maybe on your family. It's more to reflect about that. That's it.